After actor Angelina Jolie revealed in a New York Times op-ed that she had a double mastectomy due to a genetic mutation, more women have elected to have that procedure done. Today, doctors Danielle Deluca-Pytell and Linsey Gold join us in studio to talk about this trend. So for people as confused about it as I am, what is the Angelina Jolie effect?
Well, I noticed as a plastic surgeon when Angelina Jolie came forward to talk about having a double mastectomy as a preventive treatment for breast cancer. She has a gene that can give her a very high risk of having breast cancer. A lot of people just assumed that everybody should have a double mastectomy for breast cancer. So when people were coming in with cancers that were otherwise treatable by much less aggressive methods, I was having a lot of conversations about doing a double mastectomy and doing things that are going to be better for my health overall, and really having to work very hard to explain that there were pretty significant differences between people who have the genetic mutation and then other people.
Yeah, that's what I was. So even if you have the genetic mutation, that doesn't necessarily mean you'll develop breast cancer, right?
It doesn't necessarily mean that. Your risk is significant, though, to the effect that it is considered reasonable to do what we call risk-reducing mastectomies. We can never eliminate the risk, but we can reduce it to the lowest risk possible. And we say for most women with BRCA1 or 2 deleterious mutations that their lifetime risk can be up to 85%. So, you know, generally if they live long enough, there's a pretty good chance they will develop a breast cancer, and because that's so high, we consider risk-reducing measures.
So do you think that something like this, somebody so popular coming out and saying this is what I had done, is that more helpful or hurtful? Are some women now rushing to do it unnecessarily?
Well, I think maybe a little bit of both. At first, I was really excited that she was talking about having mastectomy reconstruction, because there was a really long period of time where that wasn't talked about. And there's been a very big change in the reconstructive world and the breast cancer world, where it used to be that nobody had immediate reconstruction, everybody just had a mastectomy, and then women were left to deal with the reconstruction later. Over time, it's gotten to the point where it's almost flip-flopped, where now almost everybody has immediate breast reconstruction. So there's never this period of time where you go without any sort of breast. And that's been really, really good for our patients. But then now we have this sort of other, it's almost like this fringe group that wants to take it even further. You know, you can have a cancer, it can be extraordinarily frightening, and people will have this surgery for peace of mind. But that's not necessarily without risks. Having a breast cancer reconstruction is a really, really big operation. There are risks that can occur, including having the reconstruction fail, and it can put a lot of undue stress on somebody who's already going through something that's difficult and could have been solved with a much easier operation.
Yeah, and how do you talk to those patients, Dr. Gold, if they're saying maybe this is a road I want to go down?
Well, I have some analogies I use. I say if you were getting a screening colonoscopy and the doctor found a tiny little tumor in the right side of your colon, they would just say, hey, we're going to take that portion of your colon out, put you back together, and call it a day. You'll be out of the hospital in 3 days. You wouldn't tell the surgeon, take out my entire colon, you know, sew up my butt and give me a colostomy. Like, nobody would ever say that. But obviously people aren't emotionally attached to their colons. That's a big difference. So I try to put it in perspective for people. Some of the benefit of Angelina Jolie was bringing the idea of genetic testing and the importance to the forefront, and now we test just about everybody in our practice for a genetic mutation, so that's been really positive. But you do have to sometimes peel people off the wall and really tell them what their actual risk is.
Yeah, there's never a one-size-fits-all. Thank you both so much for joining us.